We're also going to record this for our YouTube channel. So if you are watching us via Facebook Live and have questions, please know that you can use the comment box on Facebook Live to ask. If you are watching us via the Zoom presentation, use the chat feature, which I've sent you a couple of chats, but use that chat feature to send us any questions. And if you are watching us via Zoom, make sure that you like and subscribe to, or I'm sorry, if you're watching us via YouTube, make sure to like and subscribe to our channel so that you can watch all of our videos and you don't miss out on anything. My name is Jasmine Alderson. I'm the spa director here at LUX Medical Spa. Today we are doing our virtual open house during our 30 Days of Luxury event. We're talking about Dysport, Restylane, and Sculptra, the Power Trio. It is presented today by Erin Hutcheson. She's one of our nurse practitioners here at Hilton, or in our Hilton Head office. And she's controlling the PowerPoint. So Erin, go ahead and hit the next button for me. I'll tell you a little bit about LUX Medical Spa. We are co-owned by two doctors, Dr. Carmen Trewick. She is also our dermatologist, our board certified dermatologist, and works at May River Dermatology. And then Dr. Frederick Winiger, who is our board certified plastic surgeon, and he also works at Winiger Plastic Surgery and the hair restoration of the Low Country. Again, today we're talking about Restylane, Dysport, and Sculptra. But LUX Medical Spa has been open since 2014. We just opened our Hilton Head location about a year ago. So we have, in addition to Erin, we have the other injectors, of course, Dr. Trewick and Dr. Winiger, and we have two PAs, Karen Bouchard, our PA, who's mainly out of our Bluffton office, and then also Susan Coker, our other PA, who's mainly out of the Hilton Head office. So if you have any questions, like I said, or any feedback along the way, make sure to just use the chat feature here, and I will stop Erin and get your questions answered. And Erin, I will turn everything over to you.
Awesome. Thank you, Jasmine. All right, everyone. My name is Erin Hutcheson. I'm a nurse practitioner here at LUX. Today, we're going to be going over Galderma's portfolio of products. So Galderma is the manufacturer of all the Restylane line of fillers, also Dysport, which is it's a neurotoxin that's similar to Botox, then Sculptra, which is a biostimulator. So it's not necessarily like a hyaluronic acid filler like the Restylanes are, but it's a biostimulator that causes the body to produce its own collagen over time. Now the fillers, the Restylane line of products, it's formulated to act like your body's own naturally occurring hyaluronic acid to help to restore volume to your skin. Restylane Silk, the regular Restylane L and Restylane Lift use Galderma's innovative NASHA technology, and it's what gives each product a unique particle size for a tailored treatment. So there's finer particles for more fine wrinkles and detailed shaping. That'd be more like your Restylane Silk. And then you've got a more medium-sized particle, and that's for more moderate to severe wrinkles and folds, and that would be your Restylane L. And then there is a larger particle for severe wrinkles and greater volume. So that's your Restylane Lift. Restylane, I'm sure you can see the Refine and the Define on here on the screen. Restylane Kiss is also going to be in this category as well. They are flexible hyaluronic acid gels, and they use expression technology. So they're designed to give you the flexibility to show your natural range of facial expression. And this chart does a really great job. Not only are Galderma's portfolio of products on here for the HA fillers, but other HA fillers are on here as well, such as the Juvederm products like Voluma or Juvederm. HA fillers are, they've been tested basically for firmness, that's G prime, and flexibility, that's the X strain using rheometry. So G prime, that basically reflects the gel's strength. So in terms of strength, I mean support of a product. X strain is more of an index of the gel's flexibility. So, basically it's like how much strain can you give a gel and it still be reversible and not firm. So you know, Galderma has the most broad portfolio of HA fillers currently on the market. They have a product with the highest G prime and structural support, and that's Restylane Lift. It is named for giving the highest lifting capacity in the cheeks. And now whenever I say lifting capacity, I don't mean it's gonna do kind of like what we all do in the mirror whenever we pull the skin on our lateral cheeks backwards, you know, towards our hairline. It won't give a surgical result either, but it really does a great job at kind of expanding the soft tissue envelope of our face in a way that not only just replaces volume in the cheeks, but it can also provide support to the lower third of the face as well. So that's the highest G prime product, Restylane Lift. Then Galderma also has Restylane Refine. So you're going to see that all the way down there at the bottom, all the way to the right. That is the most flexible product, providing support in areas of really high movement and animation. All the other HA fillers kind of fall in between these two products. I know that's kind of a lot on that one slide. Now, these next few slides are going to kind of look a little bit similar. Each one, though, is going to depict different changes. There's 3 main structural areas that you see changes in terms of aging. That's going to be in your skin, your fat pads, and bone. When we think about, so looking at the skin, this picture does a good job, you know, a person who's 35 versus the skin changes once you're 45, and then the skin changes at 55. When we think of skin of like a child or a teenager, their skin's more like a fluffy duvet. So it's real full and fluffy and not prone to wrinkles. So a child or a teenager, even someone in their late teens and early 20s, you know, you can make every type of facial expression that you want and your skin just bounces back and you don't have those lines that start to set in and that get visible even whenever we're not making expressive faces. As our skin gets a little bit more thin, it's more like a sheet rather than a duvet. So sheets are a lot more prone to wrinkles in comparison to a duvet. So that's kind of a good way to think of skin in terms of aging. Then this next slide goes over the fat pads. So fat pads, when we're younger, we have this real smooth transition in between our fat compartments. This picture really does a good job showing those different fat pads. And you can see in that first picture how well it almost fits together like a puzzle. And then it's like these puzzle pieces get further and further apart, you know, as this patient, you know, moves through the aging process. So again, you know, that's whenever those puzzle pieces are real close together, everything is real smooth. But then as we get older, we start to get more of just the sharp transition that starts to create those lines and wrinkles. And then in terms of bone, as we age, I don't know if everybody knows this, but our facial skeleton actually starts to become smaller. The foramina, on the other hand, become bigger. So whenever I talk about foramina, I mean such as the one around the eye. So you can see the eye socket basically in this picture. And when she's 35, it's a little bit closer to her eye, and then it seems like the area just gets a little bit bigger and bigger. We also start to see protrusion in places like temples. So a lot of people start getting temporal hollowing, you know, bone resorption and lack of projection in the cheekbones, the maxilla, the mandible. So, you know, disruption in the jawline. But then that orbital area is also becoming larger. So losing the skeletal structural support also contributes to things like descent of those facial fat pads that we just saw on the previous screen, resulting in jowling, disruption in jawline, and all the things that we start to see. So the descent of those fat pads, it's just sad. So we have all this, you know, we have a full face, and then as we start to age, it's like we lose the fat in our face, but then seem to gain it everywhere else. So it's, I guess, the joys of getting older. And now a filler, so a filler like Restylane Lift, even though, like we talked about earlier, it won't give a surgical result, nor will it fully, like, truly lift up, I would say, lift up and take care of skin excess, but it will be able to help expand out that, you know, just think of the skin on the face almost like a soft tissue envelope. And the Restylane Lift being able to, that HA gel filler with a real strong structural support, you're able to put it in an area where you need that, basically. So think of in the lateral cheeks. So it's going to be able to help replace that volume and also provide support not only to the cheeks, but to the lower third of the face as well. All right, and this next slide here talks about Dysport. Dysport is the neurotoxin that is similar to Botox, just a slightly different manufacturing process. And of course, you know, Dysport is made by Galderma and Botox is made by Allergan. It does provide a very natural look. It is faster acting than Botox, and there is studies that show a 1 grade improvement in more than 1/3 of the patients, lasting up to 5 months. So that's the longest you know, study out there in terms of neurotoxins. It also has a real self rating of 97%, meaning 97% of patients absolutely felt that the Dysport was worth it in getting the treatment. So again, Dysport is more for, think of wrinkle relaxer. So it's not working to fill volume, it's working to help reduce the movement of the muscles that cause the lines of expression, basically. So whenever we lift our eyebrows, that's our forehead muscle, you know, elevating those eyebrows, creating those horizontal lines across our forehead. And this next slide does a good, oh, go ahead.
Yeah, Erin, you may have answered it for, but we did have somebody ask to explain the difference between Dysport and Botox. So can you explain just a little bit more?
Yeah,
if there is a difference?
Yeah, so there are ever so slight differences. Dysport is, so it's going to be like a long word that I say here. So Dysport is abobotulinum toxin. Botox is onobotulinum toxin. So slightly different, and both Dysport, it does start to work just a little bit faster than Botox does. I know whenever I had it, I felt like it kicked in about 2 days sooner. I think some people say it's about 72 hours. I don't know that it lasted longer on me, but there are, you know, the studies are there to say that it does. You can have the result, or up to a 1 grade improvement anyways, up to 5 months, versus Botox is more like 3 to 4. That kind of answer it?
Yes, she said thank you. Just let us know if you have any other questions. That's a great question.
Perfect. All right, and then this picture here, this does a really good job depicting the glabella treatment. So the glabella complex, that is the little group of muscles that works to bring our eyebrows in and down to make almost like that furrow or those number 11 lines. So if you look at the eyebrow after Dysport, notice how the horizontal line that's above the nose and how the vertical line that's in front of the eyebrow is diminished, and how little the eyebrow itself actually like drops down when the person is making a frowning face. So you can still tell, even on the treated side, that the person is looking intently, but the dynamic movement that contributes to those number 11 lines is reduced enough to help prevent and soften wrinkles in this area. So that's just one area that we tend to use Dysport for. Of course, it's often used, like I mentioned, those forehead lines, also in the crow's feet as well. And then on to our next slide here. This is, it does a really good job of kind of showing what the HA filler, what the HA gels actually look like. So the Restylane family of fillers, they are, I kind of touched on this before, they are divided by 2 different technologies that define why and where we place product. The original Restylane, the Restylane Silk, and Restylane Lift are all the NASA technology, meaning it's natural entanglements of hyaluronic acid that have been minimally manipulated, providing a timeless and trusted 20-year safety and satisfaction. Restylane Refine, Define, and now Restylane Kiss are all part of the expression technology, and that's the expression technology basically helps the tissue, the filler, to integrate into the tissue, providing a more flexible finesse and balance in areas of high expression. And whenever I think of areas of high expression, the most common areas to me are around the mouth. So, you know, a really firm product in an area of high animation might result in more of a firm look, if that kind of makes sense. And also Restylane Lift, it is a safe, effective, and dissolvable HA filler, and it is currently the only HA filler FDA approved to treat not only your face, but your hands as well, to give a smoother and fuller appearance. I'm sure you can see in the picture there the difference in her hands. It's very subtle, it's very natural looking, nothing looks strange about it, just makes it to where you can't see those tendons and those vessels quite as much, just like it said before, just a more smooth and fuller appearance. All right, and Restylane Kiss. So Kiss is the newest HA filler to join the US market, and it has had a ton of success over in Europe the last 6 years. So it's not that it's just brand new this year. It's just in terms of being on the US market. It was named Kiss because it's specifically indicated and designed for the lips and perioral lines and the oral commissures. The oral commissures are the corners of the mouth. Lips are one of the most prominent features of our face, and just small changes can result in a more youthful appearance and facial harmony. You know, when we think of lip filler, what's the goal? Like, every patient might have a different goal. It could be for balance, volume, symmetry, hydration, definition, or even improvement of the fine lines around our mouth. The great thing about Restylane Kiss is that it's firm enough to give you structural support and definition, but it's also flexible enough to allow for natural expression rather than really firm lips. And in a study of 273 patients, Kiss was able to provide a 1-grade improvement up to a year after treatment, and that included no retreatment within that year. Less product was also needed in comparison to Volbella, and subject and partner both felt that the lips were natural and were nice to kiss. No other lip product has done a kissability study test or study like this, asking not only the patient's feedback, but their partners as well.
We have a question.
Yeah.
Can any other Restylane products be used in the lips?
Yes. Restylane L is also indicated for the lips, but you know, we've used Restylane Refine and Define in the lips as well. I've never placed Lift in the lips. I'm not sure if anybody has. That just doesn't seem like a product that would be good there. It's just a little too firm. But yes, definitely Refine, Define, Restylane L, and then of course Restylane Silk. Restylane Silk's a softer filler, but it's got a little bit more of that G prime and support than the Refine does.
Great, thank you.
Yes, ma'am. All right, let me get back to our previous page. Perfect. All right, and Sculptra. So Sculptra, it's different from HA fillers in that it is an FDA-approved injectable that helps to gradually replace lost collagen. So usually around the age of, you know, between 28 and 30, our collagen really starts to diminish, and we start to see a pretty big change in our skin, basically from the age of 30 to 50. You know, lost collagen is a huge cause of facial aging. And the nice thing about Sculptra Aesthetic is that not only does it improve volume, as you can see in this picture here, the next picture is going to be even better. It helps to improve volume, but also stimulate that collagen production. So not only are you treating a symptom, but you're treating a cause of aging as well. So it's used to help to correct shallow to deep facial wrinkles and folds. It can be used for the nasolabial folds, which are the lines that run between our nose and our mouth. Some people call them the smile lines or parentheses. Also, it can be used in the lines framing your mouth, or the ones that run from the corner all the way down to your jawline, or the marionette lines. And then it can also be used on the chin as well. And this picture here does a really good job showing this. So Sculptra, your results are not immediate. It's kind of a time commitment. This picture here, you can see the top left picture shows her before, and then after 2 treatments, you know, moving on over and then looking down at what she looks like in 3 treatments. I mean, that one at 3 treatments, looking at the difference in those smile lines, those nasolabial folds, and her lower face, it's just so much more smooth, so much more transition, but she still looks natural. It doesn't completely efface her nasolabial folds, which would look a little bit strange. You don't want your face to look like a pillow. So she's got, it's a nice natural result. But then you can see here after 2 years, she still looks much improved in terms of her lower face. All right, and also Galderma, they have a rewards program. It is called Aspire. You can earn basically points with pretty much any treatment for a product that's manufactured by Galderma. And it's super easy to use. They even have an awesome app now. The app is very user-friendly, and not only do you get basically this certificates, like this $20 certificate here, you also get them from not only doing treatments, but also from things like answering questions or even uploading photos onto the app as well. And now we're going to go into some of our before and afters here at Lux. I didn't include a ton of them because I didn't want to, make this talk last for hours. But I know Susan and Karen have a huge, huge portfolio of photos. But of course, every patient photo that we use, the patient does sign a consent, a separate photo consent. So it's not something that you sign, during every treatment. It's, it's completely separate. So if you're signing it, and also the patients have agreed to have their photos shared. And we even indicate whether it's, if it's going to be on social media or if it's for a website or a seminar, and you can, be specific, and also specific to what areas you would like to share as well. So no patient photos would ever be shared without their permission. And with that being said, we'll go ahead and go to the first one here. This is a combination of a couple of the Galderma products. So this patient had Dysport to her chin, which is that wrinkle relaxer. So it worked on that mentalis muscle. As we get older, that muscle starts to upturn a little bit, and it's almost like we start to get a little bit of witching to our chin, and then we get a deepening of our labiomental crease. That's that crease in between our chin and our lip. So the nice thing about Dysport, even if this patient was relaxed, her chin, it would seem smoother, and it helps to also shallow out that deepening of that crease. So that's a nice thing that you do, and that's even without filler. But this patient did have 1 cc of Restylane Refine to her perioral area, that's just around the mouth, and also to her lips. So you see a huge reduction in the wrinkles, especially dynamic, and the ones that would be there at rest, all the way around, and her lip shape. So her lips, they don't look, I know everybody that thinks about lip filler, they think of duck lips and projection and that type of thing, but that's not necessarily what filler is for. Lux really does a good job at, all the providers, at priding themselves on really natural results. And this is a perfect example of that. It's just bringing back some structural support and definition and hydration to this patient's lips, even symmetry as well. They're more symmetrical. And it's just a beautiful result. So again, that was Dysport, which is the neurotoxin, and Restylane Refine. This is Restylane Kiss, and this is immediately after the treatment. As you can see, this patient in the before, her lips were ever so slightly starting to invert just a little bit of lack of support there. So just a little definition was given, and also providing some hydration to help with these fine lines in the lips as well. Also just really helping to define out the border and help to sharpen up the Cupid's bow as well. And this was immediately after treatment, so she does have some swelling here. And this is Dysport.
Hi, we have a question. Can you explain the hydration?
Yeah, so hydration, think of it almost like how, whenever you put lip gloss on your lips, it's like it seems to make the little fine lines that we have on our lips, it helps to kind of efface them. So this patient, had we just put just a smidgen of product just kind of in the body of her lip there, it wouldn't necessarily just project her lips out or make them bigger. It would just help to kind of, the Restylane Kiss, which is what was used here, would kind of help to just fill in all those nooks and crannies to make more of a smooth appearance. And that's what I mean by hydration. And then Dysport, this is a picture of this patient raising her eyebrows. So as you can see, those horizontal lines that were across her forehead have greatly diminished. I know it's hard to tell with the blackout on her eyes, but she does still have ever so slight control of her eyebrows, so she can still move them slightly. It's just those dynamic wrinkles that are above the eyebrows, those horizontal ones, they're just greatly reduced. And this patient here had Restylane Define, 2 syringes, so that's 2 cc's. And also another nice thing to think about, some people might think, oh my gosh, a whole cc, that sounds like a lot, or 2 or 3 sounds like a lot. 1 syringe is 1 cc. 1 cc is only 1/5 of a teaspoon. So think of a normal little teaspoon and only filling up 1/5 of that. That's how much 1 cc of HA filler is. So this patient had 2. She had 2 cc's of the Restylane Define, which is the got a little bit more structural support, but it's also got that flexibility too. So it's really good where it was used for the nasolabial fold area, and also looks like a little bit might have been used in the marionettes as well. So just a really, really nice result. And this patient here, I believe, I think that was the most recent one that I added was Karen Bouchard did this treatment, and holy cow, whenever I saw it, I was just completely blown away. So the first thing you notice is how much brighter her under eyes are. So 1 cc of Restylane was used, regular Restylane L, that's that original Anasha technology. Then also 1 cc of the Refine, the Restylane Refine. So now we're looking at the expression technology. It was used in that high animation area in the lips and the perioral region. Then the Restylane Define, there were 2 cc's of that utilized in her nasolabial folds, those, smile lines or parenthesis areas, and then also in her marionette lines. You can just see, she also had 2 syringes of Radiesse to her cheeks, which is not a Galderma product, but still just everywhere. This is overall like a full facial rejuvenation here. Absolutely beautiful result. You can just see how much softer her nasolabial folds are, and look at the definition in her lips. Also the patient almost looks kind of harsh in this first picture, and then everything is just like so much softer in the one on the after picture. So it's crazy how a little bit of changes in volume can not only change the appearance of, folds and wrinkles, but it also changes almost how our mood is presented in our facial expressions, even just at rest. So that was just a really, really good result that I wanted to share there. And another neat thing, since it is our open house, you can receive this awesome Jane Iredale gift set when you buy any 2 syringes of any of the Restylane fillers, or if you buy a syringe of any of those Restylane fillers and an area of Dysport. Now, of course, this is while supplies last, but it is a great little gift set. So that setting spray, that's actually the one that I use. The Dream Tint is great. So it's like a lightweight tinted moisturizer. A lot of people like to use stuff like that during the summer. This lipstick, it's not like a normal lipstick. It's almost like I don't know if I want to call it a stain, but it's ever so slight, just helps to bring out the color in your lips just a little bit. And the Smooth Affair, that's the primer. And this is our 30 Days of Luxury. So this goes over all of our specials for the entire month. So for the rest of this week, all Dysport, Restylane, and Sculptra are all 10% off. And that's the whole line of the Galderma products. And I might go ahead and let Jasmine take back over from here.
Sure, yeah. We just wanted to show you this so you can know how to book your appointments or take advantage of the specials for the rest of the month. Don't worry, if you have already missed something, this is a secret. We're only telling those of you who are joining us and watching us. If you missed something from last week or you can't get in time this week, we are going to have an encore event on the 28th, 29th, and 30th. Where everything is going to go back on special. But today and tomorrow, you can purchase these things for this week, the 7th through the 13th, by calling, by stopping by. Well, we're closed tomorrow, but by calling or stopping by today. Also going to our store.luxhhi.com. And that's basically what we wanted to say about that. And we will continue having these talks basically all week next week. And then the 21st to the 27th, we have some talks. And we're introducing some new skincare products at the end of the month. So just make sure you're joining us for all of these talks and presentations. And we have giveaways that we're doing. So, yeah, if Erin, you want to go to the next slide. I think that was all I had with that. Oh yeah, thank you for joining us. I'm going to do a couple things. I'm going to stop the Facebook Live unless anybody from Facebook has a question. Let me just check before we stop that. No, I don't see any. And I'm also going to stop the recording. So if you're watching us on YouTube, thank you so much for joining us. The reason